The sciatic nerve is going to exit the pelvic cavity with the sciatic nerve through the greater sciatic notch, and then it's going to pass over the ischial spine and pass back into the pelvis through the lesser sciatic notch rather than going down the lower extremity. And it's going to travel along the obturator internus muscle and be located right here. So this is our pelvic area here, and that's how it innervates the external urethral sphincter and these muscles. And I'll show it to you on the male. It's not shown on the female model over there, but it is on the male. So this is pudendal nerve. There are additional branches, deep perineal and superficial perineal, that actually innervate these muscles. All right, but you don't have to know to that level, but I do want you to know pudendal nerve. So I'll leave that on here. And on the male model, you can visualize this nerve. So this muscle right here, forming this bowl-like structure, is the levator ani. All right, you guys see that? And then my fingers are on the obturator internus muscle. So now on the inside, traveling along that obturator internus muscle, you'll see a yellow and a blue and a red line. And the yellow is the pudendal nerve. And it's going to send branches. Let's see if I can. Oh, Dr. Poor penis. So here is pudendal nerve, and then you can see branches from that coming forward to the penis right along that area. When we get to the digestive tract, it also will give off branches to the anal area as the inferior rectal nerve controlling voluntary defecation. Okay, but right there, the yellow line is pudendal nerve, and that's the one that you don't need to know all of its smaller branches. So if I were to place the deep perineal muscle in here, I'm going to do it in green this time. So it forms that floor. And here you would be located here underneath this connective tissue fascia. Right? That is the voluntary sphincter for urine flow. So in the male, that's going to contract reflexively to keep urine from joining the sperm on its way out the urethra. That would not be very viable. It wouldn't allow much viability. So now let me go back to the a sagittal section of the male. And let's look at these structures as they would appear on that sagittal section. So on the model, you're going to want to look for this muscle tissue immediately deep or inferior, rather, to the prostate gland. So the prostate gland is going to be here. Then you're going to have the muscle, and then you're going to have the bulbourethral glands kind of embedded up within that. Here's the bowl of the penis, and you can see the urethra passing through. So we have prostatic urethra. Remember the three layers of urethra I wrote over there? Membranous urethra is what's passing through the external urethral sphincter. It's the most narrow portion, so if a guy is getting catheterized, that's the part that's the narrowest and the tightest to get through. And then we have the penile urethra, or again, spongy urethra, because it's in the corpus spongiosum. This muscle right here, covering the bulb, bulbospongiosus muscle. Now the crus and the ischiocavernosus muscle we can't see because they're out lateral. But this structure is the one with the horizontal septi, is the corpus cavernosum. Now sometimes I get questions saying, well, where's the bone? I thought the penis had bones in it. And certain mammalian penises do. If you go down to Monterey, hanging from the ceiling, the whale penis does have a bone. But human boners aren't talking about a bone, actually. However, the penis can, it's often, well not often, but it can is sometimes described as broken. So 2 or 3 years ago, there was some TV show and the guy broke his penis. And they're like, well, how does that happen if there's no bone? These connective tissue septi of the corpus cavernosa can rupture. And that's what a broken penis is. Okay, I don't know how or why, if it's a kick or what. But then when the penis becomes erect, it's going to tip over to one side because of the uneven filling of the erectile tissue. Yeah, it should not compress the passageway for urine or sperm. It would heal, obviously, connective tissue like that doesn't heal quite as irregular, it's not going to heal quite as rapidly. And there may be adhesions, so it may not necessarily heal straight, but it would still be functional. So now as we move down here to this region, the glans penis, can I erase this diagram over here? That's like that. So as we look at the glans penis, that would be the opening of the urethra. We have skin that covered but is separated from the surface of the glands. And that is identified as the prepuce or foreskin. Kind of exaggerated the space there. And so a circumcision is cutting it off about that level. Circumcision is cultural, it's religious, so it's kind of up to parents. The poor kid usually doesn't have any say about it. If the parents decided not to circumcise their male child, then as an adult, of course, the child may decide to have it done himself.